And before we go, Ghana as a country is making major strides towards achieving universal health coverage, and target of achieving quality health for all by the year 2030, as 30 medical professionals have been trained and certified under a global health quality improvement program, SafeCare. These 30 trained and certified healthcare professionals were drawn from member facilities of the Christian Health Association of Ghana. They will be deployed to assess all 330 hospitals and clinics and also help them on the quality improvement journey and also provide Ghanaians quality healthcare in the process.
SafeCare empowers the progress in care delivery of healthcare providers by helping them measure, monitor, and improve their services using innovative solutions. Its internationally recognized SafeCare accredited standards measure the quality of healthcare provision. Farm Access Foundation is partnering the Christian Health Association of Ghana, SHAG, to implement the program. SHAG is a network of 330 health provider organizations owned by 25 Christian church denominations that accounts for an annual 6.5 million patient visits and admissions across the country. The SafeCare country manager, Bonifacia Benifo Ajay, explained these professionals from SHAG member facilities have undergone the SQA accredited SafeCare assessor training to allow them to become certified assessors.
So assessors have two key roles. One is using the SafeCare standards to conduct the assessment, which will, through that, we'll be able to rate the facility and benchmark all facilities. The second role is to be a support or provide support or facilitation to the healthcare providers within the facilities to improve or influence change for improvement. And so these are the two key roles that they are playing. So for assessments, assessors will be able to assess only other facilities that have been assigned to them.
Furthermore, the assessors are supposed to support, monitor, and influence change in the way quality healthcare is supposed to be delivered.
Approximately one assessor to about 12 facilities in a year. So in a year, they would conduct at least about 12 assessments and train 12 times, and conduct monitoring about 24 times, because they will conduct biannual monitoring. But then they'll also be providing remote support. So if the team or the providers or the quality team in the facility are embarking on some process changes and they need support, they will be contacting them via phone, via mail, and so the assessor will be sending messages and support documents, templates, and so on to support the process that they are doing.
The management of the SHAG network also explained that these practitioners will serve as trainer of trainers. Executive Director of SHAG, Dr. James Dua, is convinced that SafeCare program with Farm Access Foundation will lead to improvement in the quality of healthcare delivery and eventually reduce mortality rates in the country.
This process seeks to lead quality improvement processes that will reduce overall mortality, number one, in this country. Maternal mortality will reduce, child mortality will reduce, at least to inspire confidence in patients that if I go to this facility, I am getting minimum quality of care to make sure that I am okay. We are also looking at a situation where the expenses that we incur in the facilities will reduce because of introduction of efficiency. Leadership and governance will improve so that you have quality leadership in every institution.
One of SHAG's core values is option for the poor and the marginalized. It is therefore expected that through this partnership with SafeCare, the poor who are sometimes plunged into financial problems due to lack of quality standards will be well catered for at SHAG facilities.
Well, a good health story. But talking about health, we all do know the numbers now have racked up to 7. And we've had about, so far, 150 people and a little over all contacted and subsequently tested, and that speaks volumes about the spread of coronavirus around the world. We'll give you a bigger picture when we come to the part of the discussion. Today, we're bringing into the studio the Ghana Tourism Authority. The Chief Executive, Akwesi Agyeman, will be right here in the studio. But now, we have to take a look at what stories are occupying the front and back pages of the newspapers. Myself and Mama V were right here. Do stay with us.